10. Respiratory NCLEX practice questions with rationale. Let's start with question number 1. A client with chronic lung disease is receiving 4 liters per minute oxygen by a nasal cannula. The client becomes drowsy with a respiratory rate of 8 and an O2 saturation of 99%. Which action should a nurse take first? Letter A. Decrease oxygen flow to the prescribed target range and assess ventilation. Letter B. Increase oxygen flow because the client is becoming difficult to arouse. Letter C. Place the client supine and encourage slow deep breathing. Letter D. Remove oxygen completely until the respiratory rate improves. The correct answer is letter A. Decrease oxygen flow to the prescribed target range and assess ventilation. So the word ventilation is very important here. In chronic CO2 retainers, such as patients who have COPD, excess oxygen can worsen hypoventilation, so they slow their breathing. The priority is to return oxygen to the ordered target range while assessing airway, breathing, mental status, and notifying the provider as needed. Let's go to question number 2. A nurse enters the room of a client with acute shortness of breath. The client is sitting upright, using accessory muscles, and can speak only one-word answers. Which assessment finding requires immediate action? Letter A. Wheezing heard throughout expiration. Letter B. A respiratory rate of 30 per minute. Letter C. Sudden absence of breath sounds with decreased level of consciousness. Or letter D. Cough productive of thick yellow secretion. Okay, so let's look at the answer. Let's letter C. Sudden absence of breath sounds with decreased level of consciousness. So there are two things here that are keyword that becomes a priority. The word absence of breath sounds, and the other word is decreased level of consciousness. So let's look at the rationale. Absent breath sounds with declining mental status suggests severe airway obstruction or respiratory failure. This is an emergency and requires immediate intervention. The next question. A client is 12 hours post-op after a lobectomy with a chest tube to water seal. Which finding should the nurse report right away? Letter A. A serosanguinous drainage of 60 ml in the past hour. Letter B. Tidling in the water seal chamber during respiration. Letter C. Continuous bubbling in a water seal chamber. Or letter D. Mild pain at the insertion site with coughing. So this is very key to understand chest tubes. So let's look at the answer. Letter C, continuous bubbling in a water sealed chamber. That continuous bubbling in the water sealed chamber suggests there is an air leak in the drainage system, or worst case scenario from the patient. The nurse should assess the system and report unsolved findings. Our next question. A client with suspected active infection is coughing blood-tinged sputum and has night sweats, weight loss, and cavitary lesion on the chest x-ray. Now, that cavitary lesion is a key word in the question. Which room assignment is best? Letter A, private room with droplet precautions and surgical mask for staff. Letter B, negative pressure room with airborne precautions and fit-tested respirator for staff. Letter C, private room with contact precautions and gloves for all care. Or letter D, positive pressure room with protective isolation. Okay, so that cavitary in chest x-ray is a keyword there. So correct answer is negative pressure room with airborne precautions and fit-tested respirator. a respirator or a mask for the staff. These findings suggest TB, pulmonary tuberculosis, that the client needs airborne infection isolation with a negative pressure room, and staff needed an N95 or higher level respirator. Sorry. Question number 5. A client with pneumonia has a temperature of 39.1 degrees Celsius, respiratory rate of 32, and O2 saturation of 88 on room air, and crackles in the right lower lobe. Which prescription should the nurse implement first? So letter A, collect sputum culture before the first antibiotic. Letter B, administer a Tylenol or acetaminophen for fever. Letter C, apply oxygen by nasal cannula as prescribed. Or letter D, encourage oral fluids every hour. So this is very important to determine the priority of this patient. So with a patient who has pneumonia, the priority really is letter C, apply oxygen by nasal cannula as prescribed, because the oxygen saturation is already low. The client is hypoxic, as you see in the oxygen saturation. Oxygenation takes priority before cultures, fever management, or hydration. Let's go to our next question. The client receiving mechanical ventilation has a high pressure alarm. Breath sounds are diminished on the right side, and the trachea is slightly shifted to the left, and the O2 saturation is falling. Which action should the nurse take first? Letter A, check for kinks in the ventilator tubing. B, suction the endotracheal tube. C, call for help and prepare for emergency decompression. Or letter D, increase the high pressure alarm limit. So in this particular scenario, letter D, you have to eliminate that because we cannot change high pressure alarm limit unless there is a prior order for that. So let's look at the correct answer. The correct answer is letter E, call for help and prepare for emergency decompression. So when you have unilateral decreased breath sounds and there's already tracheal shift together with hypoxemia and high airway pressure, that gives you the if the mechanical ventilation is doing that high pressure alarm, is suggesting some sort of tension pneumothorax. This is life-threatening and requires rapid emergency response. Okay, let's go to the next question. Oh, by the way, if you're new to this channel, if you could subscribe, I want to hit more followers. We are on 260 followers right now. I want to go to as high as 1,000 so that we can hit more nursing students so that they can see our videos and learn from it. Letter number 7, a client with tracheostomy has noisy respirations, increased workload of breathing, and O2 saturation drops from 96 to 89, which is very drastic. Which action should the nurse take first? A, deflate the cough to improve airflow. So this patient has tracheostomy. Letter B, suction the tracheostomy using sterile technique. Letter C, change the tracheostomy ties. Or letter D, apply a dry dressing under the flange or the flange, however you want to pronounce it. Okay, ito po yung sagot. Letter B, suction the tracheostomy using sterile technique. Noisy respiration, increased workload of breathing and filling oxygen saturation suggests really secretion obstruction because you can hear the gurgling sound in there. The priority is to clear the airway. Number 8, a client with sudden pleuritic chest pain and dyspnea has a heart rate of 124 per minute, a respiratory rate of 30 per minute, and an oxygen saturation of 90%. Which additional finding supports the most likely complications? Letter A, unilateral cough swelling after recent surgery. Letter B, bradycardia after taking a beta blocker. Letter C, barrel chest and prolonged expiration. Or letter D, green sputum and low-grade fever. Okay, so correct answer is letter A, unilateral cough swelling after recent surgery. So this gives us an idea that this is a concern for DBT. Pleuritic chest pain, tachycardia, dyspnea, hypoxemia, and unilateral cough swelling after surgery suggests pulmonary embolism from deep vein thrombosis. Our next question. A client with acute lung injury has severe hypoxemia despite high flow oxygen. The chest x-ray shows bilateral filtrates and the client is becoming restless. Which intervention should the nurse anticipate? Letter A, prone positioning with closed airway and skin monitoring. Letter B, fluid bolus to increase pulmonary perfusion. Letter C, opioid cough suppressant to reduce oxygen demand. Or letter D, chest physiotherapy every hour while supine. The correct answer, you all, is letter A. Letter A is the correct answer. Prone position with closed airway and skin monitoring. So severe hypoxemia with bilateral infiltrates suggests ARDS, acute respiratory distress syndrome. Prone positioning can improve oxygenation by improving ventilation and perfusion matching. Let's go to our last question. A client using an albuterol inhaler reports tremors and palpitations after repeated doses for wheezing. Breath sounds are still tight with expiratory wheezes. Which response by the nurse is best? Stop the medication because the tremors means an allergy is occurring. Letter B, teach that these effects can occur and assess response to therapy and oxygenation. Letter C, tell the client to switch to an inhaled corticosteroid for immediate relief. Or letter D, have the client hold the next dose until all side effects stops. So remember albuterol as a beta 2 agonist. Okay, the correct answer is letter B. Teach that these are normal side effects that can occur and assess response to therapy and oxygenation. Albuterol can cause tremors and palpitation. The nurse should assess severity, oxygenation, and bronchodilator response while reinforcing proper use and report concerning symptoms. Share these contents with your classmate and encourage your classmate to subscribe to the channel. Thank you for watching.